It is said that every good conversation starts with good listener. With that, we begin with our today's session. This is me, Mamta Singh. Welcome you all on Wiki Forum Health and Wellness. And we have today's guest with us, who is an ENT specialist. Let me quickly brief you about what our guest comes with a background. Our guest today, Dr. Rachana Agrawal, is a consulting ENT surgeon with special interest in functional endoscopy sinus surgery. She practices at 5 prominent hospitals in Mumbai, including Bellevue, Arogyanidhi and Criticare hospitals. She has been a committee member of Association of Otolaryngologists by India, Mumbai branch, and has taken active part in management of various seminars and workshops. She also has publications in national and international journals. She is an avid Rotarian and gives back to society through free camps and surgery as a part of Rotary International through Rotary Club, Mumbai, coastline. With that, we begin with our today's session and we welcome Dr. Rachana Agrawal to our forum. We have our today's moderator with us, Dr.Shilpa Bansal Chavan, who is a consultant dietitian and she runs a multi-specialist clinic in Mumbai. So let us begin with our today's discussion and we welcome you, Dr. Agrawal, to Wiki. Thank you so much for joining us this evening and we're looking forward for your contribution towards today's subject. Yes, and the subject is we should listen it right always. So,
Thank you so much for having me. Thank you, Dr. Shilpa. Thank you, Mamta. Thank you.
Let us begin with knowing your journey. How did you started off, and what made you think that this kind of specialization is something which would, make you happy and you would be giving back to the society the way you are doing?
Okay, so I have a lot of people who I owe that to. So to begin with my parents are doctors. So I had to follow in their footsteps, whatever they said, though they didn't want me to go there. So so because of them, I wanted to become a surgeon always. And since since I was like 13, I was correcting my biology teacher on pronunciation. Right? This is not how you pronounce it. So I guess it's in my blood. I'm the third generation doctor in my family. So and I'm married to a doctor. My brother-in-law is a doctor. My sister is a doctor. My other brother-in-law is a doctor. Everyone's in it. I love what I do. I joined ENT because it has both medicine and surgery. We treat a lot of conditions only with medication. Only certain things require surgery, and of course, surgery is when it's required, we do it. But it's not our main thing. We do both medicine and surgery. And we treat across the ages. We treat newborns who've just been born and to all the way till 80, 90-year-olds, So it's across the ages. Every patient is a new person and something different, something, exciting. Plus, exciting for us, sorry. So each problem can be, has to be assessed and treated in the age group that the patient belongs to, and obviously, the other social circumstances and everything that they belong to. So it's a very diverse field. And there are, of course, many life-changing things that we can do, like newborns that can't hear. So we have this device called a cochlear implant. So we implant that inside the ear, and then they can hear. They have to go through therapy, but they can hear and they just behave as normal children. So imagine giving, the one of those five senses back to somebody. It's amazing, and it's an amazing feeling so we see so many of these 2-year-olds. They're running around, they can't hear you, and they're very hyper usually. And once they can hear, they quieten down, then they start responding. There's a whole change in behavior. So it's really beautiful. I think ENT is the best line. The happy patients, they come happy, they go happy.
Of course, when you said that giving back, those one of the senses which the kids are born missing uh, at birth, and giving back to them is simply an amazing feeling for those kids, wherein um, and for elders as well, when they slowly
Yes.
gradual and when they mature and they go aged, it becomes really tough for them, and also the people around to if they are on far off, ask calling them or talking to them becomes really tough. But yes, with the technology and with the doctors like you, it has proven that yes, there's something which can be done, and technology is definitely helping on that front.
Yes,
Apart from
yes.
that, what are your hobbies, and what keeps you self motivated? You seems to be having a lot of energy, and your smile itself says that. So what is it which keeps you motivated always?
So I guess the standard answer should be Pranav and I, my husband, we love to travel. So we travel a lot, and seeing the world, seeing new places, it opens up your eyes. It's lovely. I mean, I guess nobody would deny traveling is fun. So we like to go places, see new things, see new people. Also, I paint, so that's fun. Yeah. So the lockdown has really given us a lot of time to catch up with our hobbies. I mean, since surgeries and all have come down, people don't really they don't come much to the hospital. We done telephonic consults and everything, but still the load is much less. So painting.
Yes, so that is something which is a really a mindful exercise which gets your creativity out. Um,
Yeah,
yes,
and
thank you for
practices
joining
your
us.
surgical hand.
Yes, 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 of course. That goes without saying, of course, yes. So thank you for joining us. I'll straight away take, with no more time from your end, and we'll straight away drive to our today's topic, and would like to welcome Dr. Bansal to take ahead. Thank you so much, Rachana, for joining us.
Thank you.
Hi, Rachana. Thanks,
Hi.
Mamta, for that beautiful introduction and a good invite. So, Dr. Rachana, you are invited in a beautiful way. Fine. So, now as we deep down dive in the subject, let's start. Now, we have a few questions out here, because some commonly placed and, so COVID has affected everybody. How has COVID affected your specialty? And before that, I would like to say that there are very few ENT female surgeons. So you definitely have a plus point over there of one of the few female ENT surgeons. So a clap for you for that, right?
Thank you.
Yeah. Now,
Thank you.
yeah. And now tell us that how has as you COVID affected your specialty?
So, COVID has actually affected our patients positively. Because of COVID-19, a lot of people have started living a healthier lifestyle. They take care of themselves. They do steam inhalations regularly. They take kadhas. They exercise. All this actually helps a lot in ENT diseases. And many of our chronic patients, the long-standing patients with allergies and all, they've become much better just by looking after themselves. So it's really helped a lot in that sense. And of course, as doctors, our specialty is most at risk because we are the ones facing the mouth and the nose of the patient at all times. So we had to go through the whole PPE, gloves, masks, everything. So, of course, now that the incidence has decreased, so now we can just make do without the PPE. So now our patients recognize us. They know who they're going to.
Even you recognize the patients in for that matter. Otherwise,
Yeah.
you wouldn't know
Though I've
that
had
who
so
is
many
who.
patients. Yeah. So I have met so many patients saying, "Doctor, just remove your mask for 1 minute. I want to see your face."
Right, right. So that's indeed
Of
a
course, they would be
compliment.
missing
And
your smile indeed.
I show them my
right,
DP.
right. So now, as the other questions, which we commonly hear, like everybody in this world now has become digital. So everybody wants to put in the in the earphones, whether it is work from home, whether it is anybody who's learning music or hearing music or not doing anything also for that matter, they plug in and they have it on, whether you see in the bus, whether you see on the road, everywhere. So everybody, people have got earplugs. Now that is also, it's a plus point as a negative point. So negative point, what I have heard from patients saying, there is pain, there is itching, there is redness, there is fungal infection. So of course everything has a plus and a minus point. So what is your experience in that?
So, being an ENT, I'm very much against earphones, only because I've seen it traumatize the ear canal so often. So the thing is that any earphones which you wear, they have to be soft and pliable. Like the tip has to be soft. If you go for style and you wear those AirPods, I mean, AirPods are good. The sound quality and all is good, but AirPods hurt. I've had a lot of patients coming saying that their ear canal is hurting, and then if I'd ask them that, do you wear a lot of earphones? They say, yeah, yeah, and then they say, yeah, that's when it started. So so that's one point, main point I wanted to make. Second, when you're listening on the earphones, you have a tendency to keep the volume very high. So I would request everyone to keep the volume less than 60% of that volume range, because above that you can cause permanent hearing loss. When when there is hearing loss because of damage to the ear, because of sound, loud noise, it's like almost irreversible, and then we can't do anything. Medicine, surgery, nothing is going to help. So it's something that is avoidable. So please avoid it. Also, when we're wearing earphones, if that causes a problem, wear headphones. Headphones are better, or listen on the speaker. Speaker is obviously the best. It doesn't harm the ear. It keeps you comfortable, and also your mother knows exactly what's going on. So
Yes. So in all the ways that is helpful. So we have choices and
yes,
people should make use of the choices, especially those who work from home. They are continuously on call. Maybe the media companies, the, this CA companies, they are all the time on call. So they should pay heed to your advice and they should either wear hot headphones or they can use speakers too. Fine.
speaker. If it starts
Now,
paining, yes, at least for a while.
yes, yes, yes. So they can keep on changing. Right. And sometimes they say that डॉक्टर मेरे कान में ना वो कुछ होल हो गया है, होल, तो मेरे को नहीं समझ रहा है कि क्या हो रहा है और पानी भी निकलता है. So what would you say it could be? It could be a common ear infection, or I don't know what, or maybe there's a hole in the direct this eardrum. What would you say
Yes.
for
So
this?
yes, so a hole in the ear usually means a hole in your eardrum. So this can happen because of many reasons, like if you have a cold, or if you have some infection, or even injury. You can do it to yourself by a earbud or something. If there is a hole in the eardrum, that can be really quite annoying to the patient. This causes a lot of discharge, a lot of pus coming out from the ear. It can cause, every time they have a cold, there will be water coming out of the ear. So they need frequent medications and frequent visits to the doctor. This can get really tiring, because all that we can do without is to give medication. So when we give medicines, the pus and pain and all goes down, but the hearing loss will stay because of that hole. So it's like a hole in a cloth. Okay, it's if there is a hole in your clothes, it will open up, right? So it's the same with the eardrum. We need to do surgery to repair it. Once it's repaired, then all those problems go away. So the surgery itself is not something not to be scared about. People often get scared thinking that, oh my God, my ear is going to go away. We don't do anything to the external ear. The ear is going to stay this way. It's not going to become lopsided or something like that. We make a small cut behind the eardrum, or sometimes in front, depends on what kind of approach we want. And like after the surgery, you won't even know. Maybe after a few months, that cut will also disappear. The ear looks the same. Nobody can tell that you have undergone surgery. And it's a relatively painless surgery. I mean, the patient is fine that evening. You can walk around and do everything that you want. I mean, except for like you should not pick up heavy things, and you should not sneeze and give pressure to the ear. But otherwise, they're absolutely fine. We do it under local anesthesia, so there is no general anesthesia side effects also in this surgery.
Local is quite good. Even
Also,
endoscope
patients
is
with
used in this surgery.
Yes, we can use an endoscope. So then the cut is made inside the ear, so nobody can tell at all. And we do it endoscopically, so we can also record it and also show the patient post surgery. Um, it's technology helps.
Yes, definitely. If all the things are better off with the post operative part being lesser and lesser, and people go back to work immediately and things like that, it is very much financially and otherwise helpful. Fine. I think even elders have this issue as the aging takes place, that they become hard of listening. And that is how we realize when we talk to them on either a mobile or a phone, their volume seems to be higher than the person who is talking, and that is where I think one can make out that there is some hearing problem. Is it true? Am I correct? That how do we
Yes,
recognize that? Yes. Okay, so just
yes.
enlighten on this, that how do we go ahead with this kind of thing, how do we explain that person, and how do we help him with the hearing aid if required?
So, most adults after the age of say around 55, 60 start having a little bit of a nerve loss. The hearing nerve becomes weak. And so the higher frequencies, such as ee, those frequencies become difficult to hear. Now, when we are talking, we don't realize that we have modulated our frequency. Like there are some words which go ooh and some words which go e. So sometimes when this nerve becomes weak, these patients can't understand what is being said. They start missing out some words in a whole sentence. They start to lip read. Sometimes they don't understand what you're telling them, though they think they can hear, but they can't understand. Especially when there's a crowd, when there are 2-3 people talking together, it becomes difficult for them to follow. And this is very bad because this can lead to depression, and they start socially isolating themselves. And it's a spiral that keeps on going downward because of that failed communication. uh, they won't be able to hear from behind, and if somebody's standing in front of them and if they give their full concentration, then only they can hear. So, or also they put the TV very loud, so all these signs and symptoms point towards a hearing loss because of old age. And they really should wear hearing aids. Hearing aids are life changing. It's difficult for them to accept. It's easier for a person, I don't know why, to accept specs, but hearing aid is socially unacceptable, So it shouldn't be like that. They should wear it. I've had like old ajis, 85-year-olds, who wore the hearing aid, and they were so happy that they called me and they thanked me, and the whole family thanked me, said, my grandmother is smiling much more than I've seen her in the past so many years, so it helps. But you have to give them emotional support. You have to be patient with them. You have to tell them, don't throw it away, because or they don't adjust, they don't like it, so they just throw it away. It takes time.
And yeah, and I'm sure various types of hearing aids must be available, right? So in general, what would you recommend?
So that's kind of a very broad question. We have so it depends on what kind of hearing loss they have. If it's a hearing loss where it affects all the frequencies, is it a hearing loss that affects only the higher frequencies? Like I said, like E. So it all depends. Nowadays, again, we are very lucky to live in this age because we have digital hearing aids, which can be programmed such that only the frequencies that you can't hear become louder, and the ones that you can hear remain soft. So there's a lot less interference, and the noise and all disturbs a lot less now. Originally in the olden days, everything used to become loud. So noise used to really irritate the people wearing hearing aids. So now it's not like that. You can program it, and you should often get it programmed so that it suits your hearing. So any company is good. Make sure the service center is close by. Make sure they do good servicing. When you wear the get the hearing aid, you should have a hearing aid trial. There should be somebody with you. You should preferably ask people to talk from either side. So if two people are talking from either side and you can understand what they're saying, it's a good hearing aid. Also, go down in traffic, see when there is noise and all. Then can you understand what somebody is saying? That's a good hearing aid. So these
Wow.
are just few
And I'm
tips
sure
and tricks.
lot of variety is available, and lot of even the price range it could be available, and one can pick up as per their
Yes.
need under the guidance of an
Yes.
expert doctor, and that is how it would help them. Right, right. Now sometimes we see that some patients, just complain that there is, some kind of noise coming in my ear, and I, cannot concentrate on anything because suddenly it looks as if it's there, and sometimes it is not there. So what is this kind of ringing sound? Is it again some nerve problem, or what would you comment on this?
So, yes, a ringing sound in the ear is what we call tinnitus. So, a tinnitus can happen because of many reasons, like wax, or if there is some fluid behind the eardrum. Because if you have a cold, then that ringing is called can produce ringing. So that ringing is treatable. So that's good. But if the ringing is constant, if it occurs more in quiet surroundings, more at night, and you get constantly disturbed by that tinnitus, then you have to get it checked immediately. Okay, because this can be because of a nerve related hearing loss. So once you come to an ENT, we can do an audiogram, that's a hearing test, and diagnose this early. So if we diagnose this within 72 hours of it starting, maybe we can do something. We can give you strong medication to prevent it from increasing. Also sometimes it is reversible, but sometimes if it's beyond 72 hours, because people tend to ignore ringing in the ears, they feel it'll go away, and actually most of the time it does, but if it is a nerve loss, there's nothing we can do about it. Once the nerve has already been affected and the ringing has begun, then treating we don't treat the ringing because it cannot be cured. We treat the patient's perception to the ringing. So we have therapies such as tinnitus masking therapies. So in that, basically, the outer sound, the ambient noise is increased so that the inside noise is decreased. So it's like we tell them to listen to a waterfall, put on YouTube, put it on some soothing music like waterfall or something, which is like basically white noise. This causes that inner sound to decrease. So they feel peaceful, they feel better. But sometimes, most of the time, we just teach them how to ignore it, like traffic noise, AC noise. We have so many things we can ignore.
Yes, yes, definitely. And that is exactly what you said. The perception has to improve. Now, with this tinnitus, it can also be that they may feel dizzy, or they may have vertigo, or they feel as if everything is going round and round. It can be associated with it, and it can be an independent thing too. So, is that vertigo?
Yes. Yes, so vertigo is the sensation of spinning. Okay, so vertigo can have a lot of causes. If the room is spinning round and round, and you feel like you're standing still but everything is going round, then this can be ear related. But if it is something more like just lightheadedness, I'm going to faint, something like that, you get blackouts, then there are many other causes of that kind of vertigo, which is not true vertigo. So vertigo related to the ear, okay, we can it can be again because of many causes. If you have tinnitus and vertigo at the same time, there's something called a Meniere's syndrome. So we can treat that with medication, but it's a recurrent problem. It can happen again and again. The best type of vertigo to get, if you're going to get vertigo, is positional vertigo. We call it BPPV, benign paroxysmal positional vertigo. So that kind of vertigo is a very good vertigo to have because it's treatable immediately. Like they come, if a person comes with this and I have diagnosed BPPV, I can treat them in like 2 seconds. It's like magic. So it really helps the patient. It's lovely because this kind of vertigo, in this kind of vertigo, they basically have giddiness which lasts for like a few seconds, especially while lying down and turning to one side. It can be on either side. It can be on both sides. Sometimes it happens when they're standing up and suddenly if they turn towards one side, the room spins for a few seconds and then they're okay. This is really debilitating. Like they feel really uncomfortable. They feel the world is going to end, and they have it. It is a very stressful condition to have. But like I said, the treatment is very simple. So if you get this kind of vertigo, you really need to come and show an ENT. Don't go everywhere here and there. Neurologists, brain surgeons, all those things. You're not going to die. You should come and get treated. You'll be fine. You'll be fine. I've had a patient who had this kind of problem for 15 years. 15 years she hadn't slept on her right side. And she came to me and I treated her, and she called me that night like crying. Her daughter was crying. It was a very nice moment, bittersweet, because she could sleep on her right side. So,
Yes.
it can really help.
So in such cases, obviously surgery is out of question when you can treat with medication. So where is the scope of surgery then? Right. Yes, yes, definitely. So these are fantastic success stories also which you have narrated along with, so that people who hear, they can understand that some things are treatable, so nothing should be taken for granted. The best is visit the ENT surgeon and find out for yourself and get yourself treated. That is the best thing instead of roaming around. Right.
And
So
don't
now I think
don't get defeated.
yes, yes, that is so important. Yes. Don't give up so soon till you all try everything. Right. Now, if we think that we have completed something in ear, now we can go ahead to throat or maybe the nose. Nose, what is very common which we find in the kids, and they say naak band ho gaya, ek taraf se naak band ho gaya, and there's not discharge coming from this side, and then the doctor says aapko DNS hai, aapko crooked nose hai. So what would you say for that? Is it the commonest thing?
So a crooked nose. So the nose can have multiple problems. So a crooked nose is not a problem until it actually causes breathing difficulties or a lot of sneezing or nose blockage. So 60% of the population has a crooked nose. So that doesn't mean you need to get treated. If you're having a problem, if you can't breathe, if you are getting snoring, or if you have allergies or things like that, then you come and show. Because if it's a crooked nose, it's a crooked nose basically means that your midline bone, the bone in the center of your nose, is crooked. So it can block off one side of your nose completely. Sometimes if you do this, you can breathe better. So if you're doing this, your nose is crooked from inside. From outside, the shape might be the same, but from inside it's crooked. So again, if medicines don't help, we always give first a trial of medication. If medicines don't help, we can go in for surgery, which is called septoplasty. So in this, we again operate inside the nose, and there's no change of the shape of the nose. The nose remains the same, unless of course you want us to change the shape. That's different. But otherwise, the nose stays the same. There's no scar, there's no marks, there's nothing. It's all done from inside with endoscopes, and it's again a relatively not a very painful surgery. We keep the patient can start walking the same day. There's no bed rest that's required, and also it's not a scary surgery. It's done under general anesthesia, but the patient can go back to work within 2 days.
Wow, so that's fine with the deviated nasal septum. Now, this repeated cold also leads to what people commonly call sinusitis. Doctor, हमको तो sinus हो गया. They don't even say sinusitis. This is sinus हो गया, sinus हो गया. Now, what are these different sinuses and how do they differ and where is that sinusitis? People can't see, so they don't understand what it is. So, just clarify all that, Dr. Rachana.
Yeah, so sinusitis is can be again of, let's say, multiple reasons. So sinus. Okay, we'll go to what is sinusitis. There are four pairs of sinuses each person has. There two on either side of the cheek, between the eyes, and up here between the eyebrows. Okay, and there is one pair which is behind the eyeballs, deep inside your skull. So when these sinuses get infection inside it, then you say you have sinusitis. So how would you know you have sinusitis? If you have recurrent sneezing, coughing, a lot of swelling of your face one sided, if you have a lot of pain behind your eyes, if you have a blocked nose, all these things can be symptoms of sinusitis. Sinusitis can be because of allergy, it can be because of infection, it can be because of what we call polyps. So if it's because of allergy, uh, this sinusitis can be treated with simple medication. So we differentiate these three and many other more causes by a CT scan. So when a person comes to me with, say, sinusitis, I will give them like a basic medication. If they don't improve, we do a CT scan. We see what's the condition of the sinuses, because even just by putting an endoscope inside the nose, the sinuses are a little bit on the side, so it's difficult to see inside. We need a CT scan. So on the CT scan, we get, it's like an X-ray. We get to see with, but in like slices. So we get to see at every 3 millimeters distance inside the nose. We get to see whether the sinuses are affected because of what condition. If it is because of allergy, then medication is the way. Prevention is better than cure in allergies. They need to learn how to avoid certain things. Like, you need to find out what the person is allergic to, and the best person to find out what they are allergic to is the patient themselves. Like, they will know exactly what causes it. Like, usually it's dust, direct AC blast, sitting under the fan, some kind of food, agarbatti, perfumes, deos. These are the usual things that people are allergic to and should avoid. Also, so if somebody asks me what about an allergy test, I would say, the best thing is if you tell me, because sometimes these allergic tests can be, false positive. They say that you're allergic to something and you're not really allergic to that. Only if they're like allergic to your spouse, then go for the allergy test. So yeah.
Jokes apart, yes,
And
definitely.
yeah, so
Yes.
that's regarding allergies. So I'm sorry, this question is kind of a little long question.
Doesn't matter.
So
Doesn't matter. Please go ahead. We are all patiently
so
listening. Go ahead.
so how would you know you're allergic to something? If you suddenly start sneezing, like, if you put deo and you start sneezing, or you get sudden congestion which you can't account for, then look around, see that, okay, I just did this is probably what I'm allergic to. Because prevention is better than you know better than cure in this case. It's like diabetes or hypertension, where you can't really eliminate the problem, but you can control it. And exercise helps. So if you do some sort of cardio, just 10 minutes of jogging in the morning also can make a huge difference, because it decongests your nose. Your nose will open up, you will feel much better. So, like, I'm sorry, I keep giving patient examples, but it's the easiest way to get through. There was one
Yes,
troubled
yes.
patient. She had very, very bad allergies, and she had almost she needed daily medication. So medicines were like a part of her life. Then she started exercising and she controlled her diet and things like that. And within a couple of years, she was almost, completely better. She had maybe 1 or 2 episodes of allergic attacks in like a year. So which was a vast improvement to what she had before. So exercise really helps in allergies. So
Wow.
sorry, this the question was a bit too long, but can I just continue? So if I'll tell you
Yeah,
about
yeah. The
sinusitis
other part.
because of,
Correct, correct.
yes.
Please go ahead with
So
sinusitis and the other causes. Yeah.
so the other causes can also be, so this is easy. Allergy is just treated with medication. But if you have something more, like if you have nasal polyps or something like that. So polyp is basically a balloon. It's a sac which is full of that mucus, whatever normally comes out. It gets stuck inside that mucus lining sac, and it gets stuck inside your nose like grapes. So I'm sorry, nobody's going to have grapes anymore because of this, but it's like grapes inside your nose. So
Yes.
if you have polyps, so medication is not going to help you in the long term. Like you might feel a little better. The sac might decrease slightly in size, but it's still going to be there, unless we surgically remove it. So if there are polyps, it really needs to be removed, because otherwise your sinus openings will be completely blocked by those polyps. So nothing comes out, and you will constantly have headaches and watery discharge and swelling from your nose, from your swelling on your face. So if there are polyps, it needs to be removed surgically. Surgery again in this case is done by endoscopes. It's done inside the nose, so outside again no change of shape, no scars, no marks, nothing. It's just inside. Like post surgery, your colleagues would be like, "Oh, really? Did you undergo surgery? Because you don't look like it." I don't know what they expect, like some scars all over or something. So it's not like that. It's not like that. It's relatively painless also. You can go back to work in a couple of days. And once we remove those polyps, we put a pack for about 48 hours. And once we remove that pack, there's immediate improvement in breathing. It's instantaneous. Like they can just close their mouth and they can take a full breath for the first time in so many months. And the effect is instantaneous. Mental freshness increases, concentration increases, the oxygen level increases. So if there is a polyp, surgery. Don't get scared of surgery.
Okay. So as we are ruling out different causes of sinusitis. First, you said allergy. Second, polyp. It could be recurrent cold cough, which can be leading to sinusitis, and some typical case of sinusitis where you have seen to the reaching to the highest extent, like maybe subturative discharge or something.
As in the worst case of sinusitis, you're asking, that I've ever seen?
Yes, 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 yes.
Uh, so the worst case so a plain sinusitis, which is just nasal polyps, the worst case, we see it quite frequently actually. We see when it affects each and every sinus. Like when it's just
Hmm.
polyp. Everything is, when you look at the CT scan, it's supposed to have areas, the sinuses appear dark, they appear black. That means air.
Yes. Right.
In cases where the entire sinuses are filled, it's just gray, because there's just sinuses. You put in an endoscope and you look inside, and all you can see are those transparent bags. And sometimes it's so bad that it comes out of the nose also. Like even if they just do this, it's just like there. I've seen that.
Yeah.
It's very bad. They can't breathe at all. They're just breathing from their mouth, and they have so many other issues. Like they get so much dryness, they snore, they have lethargy all the time. It's a very distressing condition. It can come out from here, it can come out from the back also, so it can hang into your throat, and that again causes a lot of swallowing discomfort. So that's the worst polyp case. Of course, if there are tumors or cancer or something, then it can spread everywhere. That's just a miserable condition.
Different. Yes, yes, yes. So from
Sometimes
this we can.
sinusitis can also. I'm sorry. There is a special type of sinusitis called allergic fungal sinusitis. This is a little bit of the bad type of sinusitis, where it affects the eyes also. It can affect the eyes. It can affect the brain. It can go everywhere. So, and allergic fungal sinusitis is difficult to treat, because medication, surgeries, everything that we can do will give you relief for some time, maybe 5 years. Sometimes, many times it recurs. So allergic fungal sinusitis is a bad disease.
Right, right. Now, from that, what I understand is that snoring is also one of the issues. Now, snoring is also very common in many people. So, what exactly is snoring, and why does it there occur? And sometimes it also leads to sleep apnea in some people, leading to certain problems. So, could you just explain as to how all this occurs?
So snoring in itself without sleep apnea is actually the worst thing that can happen to your spouse. So it, without sleep apnea, snoring is not dangerous, except that snoring is uncomfortable. So snoring can be because of many reasons. Snoring has the cause can lie in any three parts, like in the nose, behind the nose, or in the throat. So each of these parts can be tackled separately. But before we go medically or surgically, we need if the patient has snoring, first thing they should do is lose weight. Weight loss really helps decreasing snoring. So weight loss, diet control, don't have a lot of fatty food and things like that. Also, exercise helps. Exercise again decongests the whole passage, so that helps. If this technique doesn't work, then we go in for something called a BiPAP, which basically gives oxygen during while they're sleeping. It's like an oxygen tank. And if that is also uncomfortable, or if we see obstruction somewhere in one of these levels, like if there is a crooked septum, if there is nasal polyps, all these things can cause snoring related to the nose. Then related to your throat and palate, if your tongue is very fat, it can fall backwards in your sleep, and that causes choking. So in these cases, we ask the patient to sleep sideways. If you sleep sideways, there's a lot less mass here, and your snoring can significantly decrease. There are, of course, surgeries in the throat also, similar to removal of the tonsils, which help sort of strengthen the muscles and decrease snoring. But that is as a last option if all these options don't work. Now, snoring, this is for snoring. Also, it's for what we call sleep apnea. So, sleep apnea means the person stops breathing. They stop breathing for more than 10 seconds while they are sleeping. So they would be snoring, giving out this ugly noise, and then suddenly there would be just no sound from them for 10 seconds or more. And then that's because they've stopped breathing. And that can be dangerous, because after they stop breathing, luckily, if the sleep cycle, if your brain gets stimulated, they get up and they gasp for air, like, and then they start snoring again. So if this happens over and over at night, more than 10 cycles every night, then it's dangerous, because they're going without oxygen for long periods of time. So this can cause a lot of mental disturbances. It can cause sleepiness. It can cause a lot of confusion, irritability, because basically you are having lack of sleep. So you can fall asleep while you're driving, just waiting at the signal, or if you're watching TV. So it's a very dangerous thing to have. Plus, because of that reduced oxygen going into the brain, you can have many other complications of that. So sleep apnea with snoring has to be treated either with lifestyle changes, with sleep BiPAP, oxygen delivering systems, or surgery if medication doesn't work. So that has to be treated. So if you are snoring, always get yourself checked with a sleep study, which helps us diagnose whether you are having these apneic episodes. If you are having these apneic episodes, you need to be treated.
Yeah, that's very important, and that's very rightly you have said. And now from this, I come to what is called tonsils and the voice box. So tonsils, people say tonsillitis ho gaya, bar ho gaya, so let us do tonsillectomy. Is it a right choice?
So the question actually is how much does your kid like ice cream? Would he prefer his tonsils or ice cream? So I mean, you can ask this to the parent differently and to the kid differently and see the answers. They'll be dramatically opposite. So yeah, but actually it's really funny. So we actually sort of seduce the kids who require tonsils into the OT by just letting them dream of all the ice cream that they're going to have post surgery. So they start making a list of what they're going to tell their parents. I want strawberry, I want cassata, I want chocolate. So yeah, but jokes apart, we are doing a lot less tonsillectomies these days because the indications have decreased. We don't remove the tonsils unless they have repeated infections, like say more than 5 per year. If they are constantly like a source of infection, we need to get them out for the person to get better. Then we do go ahead with tonsillectomy. Or they're so large, okay, they look like two balls, and they have they have difficulty swallowing because of that. They start snoring because of that, and sometimes they have this hot potato voice, which sounds like as if you have marbles inside your mouth. That that if they start talking like that, then yes, we need to remove them. So with tonsils, we also remove what is called we look at what is called the adenoids, which is behind the nose. So behind the nose, the same tissue like tonsils is present, which we call the adenoids. And sometimes when the tonsil has grown, then the adenoids can also be enlarged. So that has to be checked at the same time. So that, because that is dangerous, the kids stop breathing from their nose. Okay, they usually keep their mouth open, and they start breathing from their mouth. They get dark circles, their face becomes a little elongated, their teeth start coming out. So this needs to be treated. So if the adenoids we always check for adenoids when we're checking for tonsils, and if the adenoids are enlarged, then we do the same surgery. We do that surgery too at the same time. Again, it's not like we cut open the face. We do it from the mouth. And so
Yes.
yeah, like it's not a horrendous surgery. You don't look like Frankenstein after that. They after
Definitely.
surgery, everyone nobody would know also that surgery has happened, except they'll be just gobbling down a lot of ice cream. So you know that, oh yeah, tonsil baby. So yeah,
Right,
it's
right.
for kids. For kids, the recovery is a lot shorter. They get well faster. They feel better. They get more lively because there's more oxygen going into their brains. So generally, it's good if it's required.
Okay. And sometimes these people also say that, some people have a tendency to keep on shouting, keep on talking a lot. And then they say they have got a pain, and, they say, कि आपका voice box सूज गया है, or it has been stretched. So what exactly is this voice box or larynx, whatever? Can you just explain?
Yeah. So it's so if you have a loss of voice, or if your voice suddenly becomes hoarse, and you can't
Yes.
it becomes like dubbed. So if you try all your normal medication, or like normal home stuff, home remedies, steam and drinking warm water, and all that doesn't help, you need to get checked. Okay, because hoarseness has a lot of causes, and some of them can be a little sinister. But let's just go to the normal first. So when can you get hoarseness? It's if you go if you go on a picnic and you have shouted a lot, and the next day you're hoarse. So that can cause a little bit of blood collection in your vocal cords. So vocal cords look like this, and they move when you talk and breathe. So because of that movement, and if you shout, they get injured, and they can be a little blob of blood there. So this blood should be treated. Otherwise, it can develop into what we call nodules. So nodules look like breakers. So they prevent your vocal cords from joining. There's a gap which forms, and that causes that hoarseness. So vocal nodules can also happen. I mean, now they become more frequent because everyone is staying at home and shouting at each other. So they should be called lockdown nodules.
Yes.
But
New
yeah,
terminology.
I'm just joking.
Yeah.
But if you do have vocal nodules, usually at the beginning they are soft, so they're easier to treat. Just medicines, voice rest, complete voice rest, which again is very difficult for people who have vocal nodules, because they are usually big talkers, and they really give me the worst looks when I say complete voice rest, mon vrat. Then if I talk to, I talk a lot. Or they're
Right.
singers, or
Correct.
they're teachers, and they
Yes.
really need their voice. So
Yes.
yeah, so voice rest, medication. Sometimes they need speech therapy, how to remove your voice better. They give them exercises, breathing exercises. So that exercises the vocal cords, so that helps. In some bad cases, we need to go for surgery again, where we just clip off those vocal nodules, and so you can get back to work faster. Yeah,
Wow.
it can also
So that
hoarseness.
is again.
So
Yeah.
yeah, so these are some of the most common causes. Of course, hoarseness has a huge list of a whole textbook full of causes of why they can go
Yes. Yes.
hoarse. But this is
Yes.
one of the
Definitely. Yes. Commonest thing what we deal with. Right.
yes.
And of late in COVID, everybody was worried about this fungus. First, it was black fungus, and then it was white, and then it was yellow. So, what was it all, and which part does it affect?
Okay, so black fungus or mucormycosis. So it is a very, very bad disease, and all ENTs and all doctors pray that none of our patients have that. It's usually, so we used to usually see it only in patients who have cancer and their immunity has fallen, and they basically have become very weak. Then they used to get this black fungus, but now because of this COVID infection, so any patient who has COVID, has diabetes, and has had steroids, these three things are the main causative agents now that have led to black fungus or mucormycosis in so many of our patients. So again, if we have now learned how to modulate it better so that patients with diabetes, their sugars are controlled, and that even with the steroids, because steroids tend to increase your diabetes. So both have to be given such that it's an optimal balance between the two, because we need steroids. Steroids are life saving. So both have to be used correctly. So black fungus is basically not everyone with diabetes, COVID, and steroids will get black fungus. There was a lot of fear, a lot of paranoia with black fungus, and many patients have come to me with misunderstanding their symptoms with black fungus. So basically, you get a lot of dryness in your mouth. You do get a little bit of discharge. It could be a little black in color, but if you fall in this category, you should get checked. So we basically put a scope inside, an endoscope inside in the OPD itself, and look for it. It looks black. So the normal healthy lining is pinkish, and this appears as a black network within the mucosal lining. Uh, so, why does it actually happen? Is because with all this, with COVID-19 causes all your blood vessels to close. And so there's a lot of, lesser blood supply to your nose, and that causes this black fungus to attack. It won't attack normal people. If you're healthy, even if you go next to a COVID patient who's not COVID anymore, you won't get mucormycosis because you have a healthy immune system. So if you are healthy, it's fine. But if you are unhealthy, if you have all these things, then mucormycosis is a problem. It can affect your lining. Once it affects the lining, it spreads really fast. It goes towards your eyes, your brain. It can cause the eyes to you blindness. It can cause you to get squint. It can cause a lot of brain problems, and it's very toxic. So the treatment for black fungus is surgery. It needs to be physically removed and very strong IV antifungals. So that too, and we pray to God.
Yes, yes, definitely. So that is fantastic learning what we have had from you, Dr. Rachana. Thanks a lot for that, and fantastic pearls of wisdom, and great eye-opening things which commonly people believe in a different way. So you have helped us overcome that. So thanks a lot for that, Dr. Rachana.
Thank
Thank
you
you
so
so
much. Thank you
much
for
for
having
being.
me. Thank you.
Over to you, Mamta.
Indeed, what you rightly said, we had a fantastic evening today. I was just, feeling as if going ahead, we should have comedy nights with Vicky, something like that, and we should invite Dr. Rachana there. She was a fantabulous, orator, of course, with the subject, the expertise, what she's coming with. She made it really easy, simple, and with humor. She made it really very clear about the subject, what we had spoken. But yes, indeed. I have few
Thank you.
questions to you. जनरली बच्चे जब पैदा होते हैं 1.5 साल के बाद बातें करने लगते हैं. देयर आर फ्यू केसेस जो हकलाते हैं, एंड ये हकलाना इज अ पार्ट ऑफ ENT और हाउ इज इट?
Yes. So yes, it's a part. Anything above this is ENT. Not from back. So yes, it is a part of ENT. So Haklana is it's relatively easier to treat. They don't need medicine or surgery. They just need therapy. So we give them speech therapy. We teach them how to speak, and usually it disappears. It takes effort. It takes some time, and we just need to give them speech therapy. They're okay. Also, just since you mentioned this one point, I want to just say that if a kid does not speak at all for more than 2 years, no sound comes out of the lip, get them tested. They have to be tested early because, like I said, those cochlear implants, they need to be implanted before the age of 5. Then the brain is adaptive enough to get to understand and to receive the messages. After that, the brain starts dying. The audio part starts dying, and so then the response is not as good. So any person, any kid more than 2 years old who's not, or younger than that, if you realize is good. But if they're not speaking more than 2 years old, get them tested.
No, the
Okay.
special case of Haklana, I have somebody known. Can it be
Yes.
treated at later
Yes, of
age,
course.
maybe 14, 15 years, 16 years old person?
Yes. Just send me. Just
Yeah,
ping
yeah,
me.
of
I'll
course,
send you a number.
of course, of course. So, I mean, that is something, it's of course, it's a long life, and if somebody is not able to have that fluency in the communication, is something which is scary. So, yes, it was amazing talking to you, Dr. Rachana, and we had, so much to learn today. And yeah, there were so many things which we learn it from the around dictionary what we have. But yes, this is the right place, taking information from the expert and uh, connecting with them with your particular disease is something is very important. You need to notify it as early as you notice it to the right person, and get it treated, get it really well, because this is something which is scary. uh, yes, thank you so much, Dr. Rachana. Thank you so much, Dr. Bansal. We had
Thank you,
amazing
Mamtaji.
time,
Thank you, Dr.
and
Shilpa.
we're
Thank
looking
you.
forward from Dr. Rachana to join us in future. Maybe we will have more informative sessions from us. And
Sure.
thank you so much. I hope you enjoyed talking. Of course, you never get this chance when you are around with your patient. But yes, today it was more on the knowledge front, and we are trying our level best to get the right knowledge to our audience through the experts, and that's the agenda with this particular health forum. Thank you so much, Dr. Bansal, for having Dr. Rachana today, and we look forward
Thank you so much.
having you again. Thank you so much. Thank you so much.
Thank
Thank you.
you. Thank you.